This is Dr. Joe Pat Hatem, Mayor of the City of Southport. I would like to give you an update on the COVID-19 pandemic. Although Christmas Eve is 2 weeks away, for the public health, medical, and scientific community, Christmas is today. The first COVID-19 immunization was given today that was not part of a clinical trial. It is a day to celebrate and give thanks to all those involved, the corporations such as Pfizer and Moderna, the governmental agencies, the Centers for Disease Control and Prevention, and the Food and Drug Administration, the many vaccine advisory boards involved, and the citizens who agreed to be a part of the Pfizer Vaccination Study, where the phase 3 clinical trial showed a 95% efficacy with respect to the 43,000 participants who were randomized into two groups, those that received the vaccine and those who received a placebo injection. From this study, there were 170 cases of COVID-19, 162 in the placebo group, and only 8 in the immunization group. Strong data to support the EUA, Emergency Use Authorization, that was issued by the FDA on December 11, 2020. Also of note, there were acceptable side effects that were associated with this vaccine, including fatigue and headache. As stated by the FDA Commissioner Peter Hahn concerning the development of the vaccine, this is an, and I quote, unparalleled scientific achievement that will resonate for many generations, and that we worked quickly based on the urgency of this pandemic, end of quote. The science and the review process has been open, extensive, and based on data and not politically driven. The vaccine is safe and uses an elegant approach where the vaccine consists of a messenger RNA that will produce in the body a protein that is similar to the protein spike that is used by the coronavirus to attach to cells in our nasal membranes and respiratory system. Our immune system will then make an antibody to this protein spike antigen, so when we are exposed to the coronavirus, it will not be able to cause an illness in the immunized person. There is a priority in terms of those who receive the immunization, which will begin with the frontline healthcare heroes, like the ICU nurse at Long Island Jewish Medical Center, who was first to receive the immunization at that facility today. The immunization is a two-step process. The first immunization to prime the immune system, and the second immunization 21 days later to boost the immune system. It is a daunting logistical task with the shipping of the vaccine, the cold storage requirement, the thawing of the vials, the dilution for the actual immunization, with each vial containing 5 immunizations. But there's been great planning, and these challenges will be met, and distribution will be successful. After frontline workers are immunized, of which there are roughly 24 million in the United States, then the next priority will be workers and residents of nursing homes and skilled care facilities, from where 40% of deaths have occurred. The immunization for the public will begin early in 2021. We must remember this is a long road to overall immunity, where we would need between 75 to 85% of our country to be immunized for there to be herd immunity. Until then, public health mitigation measures must continue. As for the data, the COVID-19 pandemic is clearly out of control. Again, this is behavior driven. In the United States, over 16 million documented cases with almost 300,000 deaths. In North Carolina, 423,623 cases with almost 6,000 deaths. And in Brunswick County, 3,572 cases and 66 deaths. If you look at the number of cases in Brunswick County beginning in August, the last 2 weeks there were 88 cases. In September, cases broken down in 2-week intervals, 108 and 134. In October, 298 and 276 cases. And in November, 296 cases in the first 2 weeks and 465 cases the last 2 weeks of November. We have not stopped the pandemic. It could be much worse, and I want to thank all those who are following protective protocols with respect to COVID-19. For Southport, we will continue the emergency declaration with respect to city facilities through Memorial Day weekend. Full immunization of U.S. population could be possible by midsummer, so we will reassess as time and data allow. We continue to follow the governor's executive orders, and we will promote the public health measures we know that will help to stop the spread of the virus. Wear a facial covering, social physical distancing, hand washing, avoid crowds and small gatherings. Do not travel unless absolutely essential. Spend Christmas safely at home. And remember, if the immunization stays in the vial, the pandemic continues. As your mayor, as a doctor, as a public health advocate, I am asking you to remain vigilant. Continue the public health initiatives that I have described, and when the time comes, roll up your sleeve, and if you do so, as I plan to do, you'll be among one of the heroes that help to save lives.